want to tidy up after yourself. It's just good manners, all right? So put all those things away. During the time that you're obtaining your exam too, whose responsibility is it to let the patient know when and how they're going to find out about their test results? Yours, your responsibility. So good. So, you know, when they're done, they want to know, you've collected this test, like, when am I going to find out about it, right? You're taking care of your grandmother, you'd want her to know, right? And so be sure to let them know. Gonorrhea and chlamydia testing usually takes a couple days. The nurse will definitely give you a call. The pap smear usually takes about a week. It may be different in different systems that you're at, but those would be great answers to know before you provide that care with that patient, to let them know. If you felt something, if it felt normal, let your patient know. Again, good word choices. Here I'm looking on the outside, everything looks nice and healthy, this all looks normal. Normal's a great word choice, okay? This feels good, not such a good word choice, all right? This feels normal, excellent word choice, all right? If there's something abnormal, of course you're gonna want to let them know. And I think that's a nice conversation to have after you have them sit back up and you can sit and visit face to face, okay? This really is a great rotation. I know that by the time that you leave in the next 6 weeks, you'll certainly feel much more comfortable in these interactions and discussions. There's a huge vested interest in you having a really good experience while you're with us. So I will welcome any questions that you guys have right now. Other than that, we will definitely break into 2 groups, and that you will work with Dr. Finney and myself with our pelvic model. So any questions that anybody has, I'd be happy to answer them for you. One last point that I do want to make that just popped into my head is keep in mind, how many women do you think have gone to the emergency room and they're coming to see you and you ask them if they've had a pelvic exam or pap smear before and they say, yes, I was in the emergency room. How many pap smears do you think they do in the emergency room? None. The emergency room is not into preventative health screening, right? The pap smear is a preventative screening test, all right? But they sure think if you've placed a speculum, you've tested for everything. What specific sexually transmitted infections can we test for in doing a pelvic exam? There are really 3. So in your pelvic exam, well, maybe 4 if we stretch, but what traditionally are we looking for? What sexually transmitted infections during the pelvic exam? You guys said gonorrhea and chlamydia already. Trichomonas, beautiful, excellent. Maybe herpes, right? If you saw a lesion and we cultured for a lesion. When we do a pelvic exam, we tell the patient that we have tested for sexually transmitted infections. They think you've tested for everything. Have you tested for everything? No. No. What else can you test for? HIV, syphilis. How do you test for those things? Serum testing. Excellent. Whose responsibility is it to tell the patient what the difference is? Yours. Are you catching on my theme here? Yeah, so good. So it's your responsibility. If you place that speculum, I can guarantee you that when that patient walks out of the room, she thinks she's been tested for everything. So be sure that you've had a really good open, clear communication so everyone's on the same page. All right? Other questions? Things that I have forgotten? Anything? All right. Well, great. I look forward to working with you guys this morning. We are done with kind of this didactic portion now. Last tip. My kids hate this. I do this on the phone too. I say goodbye and then I keep talking. That little pink book, if you would hold that up for me, please, sir. Thank you. This little pink guide right here, don't let its small size fool you. Don't let the fact that it was given to you for free fool you. It is the best guide, hands down. Whatever you were planning on studying contraception, throw it away. This book is written by the gurus of contraception. It's updated every 2 years. In this handy little guide, it will tell you the advantages and disadvantages of every form of contraception. It will tell you the recommended screening tool at each age of the annual exam. It also has the World Health Organization medical eligibility criteria for different forms of contraception. Your patient has lupus. Which form of contraception do you want to use? It has algorithms on when do you start different forms of contraception. She's coming to see you. She hasn't had a cycle for 4 months. She wants to use Depo. How do you get her started? I mean, these are great clinical questions that you'll be faced with. This guide is the best. It also has in it how to pick a boyfriend, also how to pick a girlfriend. You can use it either way, so a handy little tip if that applies. It's a terrific, terrific little reference guide. So I would encourage you to spend some time with this book. And if you have contraceptive questions, this is where I'd encourage you to use to study. All right, with that, I really will stop talking at this point, and we'll divide you into a couple groups. Thank you for your attention.